Welcome to the Let's Fix It series about the American healthcare system. I'm Dr. Chris Robertozzi, a practicing podiatrist. My practice is in Newton, New Jersey, a poor rural community in the northwestern part of the state. Throughout my years of practice, I have seen significant changes in healthcare, both in its delivery and its cost. What you are about to hear are my perspectives and opinions. I am not funded by any organization or individual. More can be learned about this endeavor by going to the website www.betterhealthcarereform.com. The website has the bibliography so you can read more on this subject if you so choose and fact check me. As a physician, it's embarrassing to know that according to the Commonwealth Fund report of 2022, despite having the most expensive healthcare system in the world, the United States ranks last overall in the quality of care provided of any high-income nation. We are the only high-income country that does not guarantee healthcare coverage and does not have universal healthcare. In 2021, 8.6% of the United States population of 331.9 million was uninsured. That is approximately 28.5 million people. America is an altruistic country in that it helps everyone in the world when they have troubles. However, the fact that there are 28.5 million people without health care in the United States deserves America's attention and assistance. It is estimated that 20% of the homeless are veterans. These individuals were willing to give their life for our freedom. In their time of need, we have literally and figuratively left them out in the cold. Being homeless is not just a housing issue, it's a healthcare concern. In the report, the cost of healthcare is compared from country to country by comparing the gross domestic product, commonly referred to as the GDP, to the amount of money spent in healthcare. The gross domestic product is the measure of the value of goods and services produced in a country during a specific time. The United States spends 17.8% of its GDP of $27.3 trillion on healthcare. That amounts to $4.8 trillion. The average country spends 9.7% of their GDP. Having the most expensive healthcare system isn't bad if we're providing the best quality care in the world. However, we're providing the worst. How can we increase the quality and decrease the cost? The following three examples highlight the poor quality of care in the United States as compared to the other high-income nations. The United States has the highest maternal death rate of 23.8 per 100,000 live births. The average for the Organization for Economic Cooperation and Development, referred to as the OECD, is 9.8. The United States is 2.4 times higher than the OECD. The infant death rate in the United States is 5.4 per thousand live births. The average OECD is 4.1 per thousand. Then there is Norway with the lowest infant death rate of 1.6 deaths per 1,000 live births. The United States life expectancy at birth is 77, 3 years lower than the OECD average of 80.4. Japan has the highest at 84.73. My goal is to move us to the top of that list where we belong. For 42 years, I have practiced full-time and volunteered for multiple healthcare organizations, both locally and nationally. The organizational top positions that I have held include President of the New Jersey Podiatric Medical Society, President of the American Podiatric Medical Association, President of the medical staff at Newton Medical Center, Chairman of the Podiatry Section of the National Academies of Practice, Chairman of the Surgery Department at Newton Medical Center, Chairman of the Podiatry Section of the American Public Health Association, and Treasurer of Karen Ann Quinlan Hospice. As a result, I have experienced many shortcomings in healthcare. This gives me a first-hand view into the system that has failed us. It's impossible to improve anything when you do not have a full understanding of the issue. The perspective that I am sharing with you is mine, based on over 4 decades of providing podiatric care to my community and volunteering for multiple healthcare associations. I will discuss how we got into this situation and a few potential solutions for getting out of it. To find the best solutions that will make us the leader of healthcare in the world, the entire delivery of healthcare must be evaluated at the same time, and everyone that has anything to do with healthcare system must be involved. That would include all national associations of those who provide healthcare in any manner, America's health insurance plans, National Pharmaceutical Association, American Institute for Medical and Biological Engineering, and patient advocate groups. Unless everyone is at the table and understands each other's issues, a long-lasting solution will not be possible. This is a common sense beginning, but has never been done. The goal of the group must be to provide the best quality care to the citizens of the United States of America. Many of the answers are nothing more than simple solutions with the application of common sense. The subsequent podcast will talk about various healthcare system delivery inadequacies that were highlighted in the Commonwealth Fund report. The issues are all multifaceted, involving not only the delivery of care itself, but also peripheral issues that affect the care, such as the access to care and transportation. Healthcare system payment concerns and administrative burdens will be addressed. There are other bottlenecks within the healthcare system that will also be deliberated. If you want a better healthcare system and think that what I'm proposing will get our country there, then contact the organizations that will be listed in the comments section at the end. Ask them to send a representative to the Zoom meetings to start on February 5th, 2025 at 4 p.m. Eastern Standard Time. They have all been sent an invitation for the proposed collaboration on healthcare. I will provide the names and phone numbers of the various organizations at the end in the comments section, but you can also see them on the website, which is www.betterhealthcarereform, all one word, no spaces.com. It is appropriate, if no one answers the phone, to leave a voicemail. A simple statement such as, please participate in the Let's Fix It Healthcare Reform Zoom meeting starting February 5th, 2025 at 4 p.m. Eastern Standard Time. Feel free to give your name and any other pertinent information you are comfortable sharing. The listed associations received a letter in December with all the details. Those who attend will rewrite the healthcare proposition that will be sent to Congress to make the appropriate changes, whether it is a law or alterations in the delivery of healthcare. A summary of each meeting will be posted on the website within a few days so you can keep up with the progress and provide feedback. Likewise, the recommended changes that will be sent to Congress for approval will also be posted. The Affordable Care Act took 26 months from the time President Obama took office until it was passed by Congress on March 23, 2010. It was not implemented until January 1st, 2014, 45 months later. Our goal is to write the proposal, pass Congress, and be implemented in less than 6 years. Thank you for taking time out of your day to listen to this podcast. Please share this with your family and friends, and let's work together toward a better healthcare system for all American citizens. Please contact the organizations and let them know that you would appreciate their participation at the Let's Fix It meetings so we can achieve a better quality of healthcare for all Americans and reverse our rank in healthcare in the world. Thank you.